So welcome everybody. My name is Cassie Skobrak. I'm a reference librarian here at the Westerly Library, and this is our third older adult hour. And every meeting we like to highlight a different community resource. And today we have with us Catherine Taylor, who's the executive director at Rhode, oh my goodness, at AgeFriendly Rhode Island. So welcome, Catherine, and we look forward to hearing about all the resources that you have.
Great. Thank you so much for having me, Cassie. I really wish I were there physically in your beautiful library, which I just love. Just grab a cup of tea and just sit there and chat with you.
Like,
Yeah, and normally I'd be traveling to Westerly once a month, right, to be part of the age-friendly Westerly meetings, which is, Westerly is such a great place to be an older adult right now because everybody is thinking about all of us who are 60 and older and what we need during the pandemic, but, how just make Westerly just a wonderful place to grow old in. So I miss my trips down there. And I'm excited to share about Age-Friendly Rhode Island, which has changed a lot during the pandemic. We're an initiative of Rhode Island College, and we are funded by the Tufts Health Plan Foundation, which is a foundation that only funds healthy aging initiatives in 4 New England states. They only fund projects in Rhode Island and Connecticut and Massachusetts and New Hampshire. So they're really focused. It's a privilege to be able to be supported by them. And prior to the pandemic, we were basically a coalition that met to put together projects and partnerships that would support, healthy aging at the community level. So we worked a lot. As you know, we come and help, provide some advice to Westerly and some ideas, and do that in other cities and towns. And we have a number of work groups that would convene that are aligned with the World Health Organization's domains of livability. So, transportation and healthcare access and food and nutrition, social inclusion, civic engagement, things like that. And so all the things that we were doing initially before the pandemic all involved the same thing, getting people together in person. So remember, one of the things we were talking about is Age-Friendly Restaurant Week, and we were thinking about doing that in Westerly. Well, haven't been going to restaurants for a year, so that wasn't going to happen. So when this all hit, our funder, they're just really incredible. They just said to all of their grantees, it's an emergency. You might not be able to do all the things you told us that you would do with your grant funds, and maybe you shouldn't anyway. I mean, maybe you could, but maybe it's just not that important anymore. So you're out there, you see need, figure it out, and just meet it, and just give us a phone call every now and then to tell us what you're doing, which really freed us up to try to look around to see how we could be responsive during the pandemic. And we never actually did too much directly with older adults. We worked with entities like your library and the town of Westerly to help you work with older adults better. So in a way, this has been very exciting for us because our orientation has really changed. We've all of our work groups stopped meeting separately because, transportation, no one was going to do any volunteer driving, and no one was going to get on a bus a year ago. But the thing we all were worried about right away was now everybody's in lockdown, and how do we find people who are isolated and make sure that they have what they need? So our whole coalition started getting together and adding more people all the time. We had such untraditional partners as the Rhode Island Complete Count Committee, the folks who were trying to count people for the census and didn't know how they were going to do that anymore. And we had, many library partners who joined us, but also, senior centers, and we had businesses. We had folks from the community level, but also, state and local government. We had folks like Meals on Wheels and community action agencies, but just people who work on adaptive equipment. We just kept gathering people, folks, and many people from our local colleges and universities. So folks from URI, and so folks from Rhode Island College, and folks from Brown, who all, Excuse me?
I said, so you name it, really.
Yes, and we keep on trying to gather more. I just got off our weekly call just before this, and we had two new folks join us. We had the director of Habitat for Humanity, who are they're trying to help with home modifications for older adults. We have folks in behavioral health care, AARP. They're just everybody, and we have a number of older adults, and we also have it's quite intergenerational. We have a lot of graduate students and interns who are all part of the conversation. And we just started by, getting together to figure out what are people doing to find people, and what needs do people have. And it's sort of changed over the year, the sorts of things that we focused on. So at first it was, check-in calls and emergency food delivery. And those are still areas of focus. But then it quickly became apparent to us that we really had to redefine what aging in community even is, because community is happening right now like this. We're on video chat, we're in these little squares, and if you don't have the ability to do that, if you don't have an affordable and reliable internet connection, if you don't have a device of your own, and this is going back, right? Sometimes last year seems like ancient history. We thought, okay, one computer in the house is going to be a great thing. But then that means only one person gets to have community in a household at a time. So I remember being surveyed by my son's school system asking if he had access to the computer. Like, well, yeah, of course he does, because I have one. I didn't realize that he was going to have to use it all day for distance learning, and I couldn't do my work. So, I mean, really, we all have to have our own in order to really be fully accessible. And then, of course, there's training on how to use all this stuff. I live in a house with my millennial children, so I have 24/7 tech support, and I find I need it, but
Everybody does.
right, everybody needs that. And just developing the confidence with all these new platforms. Just thinking a year ago, I didn't know what Zoom was, and locked myself out of a number of meetings before I got good at it. So we really turned our attention, and then programming, which I'll get to in a minute, because your library, had closed its doors to in-person, programming. So did all the senior centers and, theaters, every place that you would go to just get information, be entertained. That was all having to go online. So our coalition really then sort of turned its attention to advocacy and projects around digital inclusion and digital equity for older people. And there's a lot of data out there that shows, even before the pandemic, that older adults don't use the internet nearly as much as younger people do. And in the 2020 Rhode Island Healthy Aging Data Report, the data is really stark up geographically. There's actually pretty high utilization among older adults kind of around the Bay. And then it gets, down here in Westerly, it's kind of in middle, but then you get to, the west side of Providence or Woonsocket, and you have less than half of older adults use the internet in the last month, less than half. So that's something that we really paid attention to. But of course, that opened the door to a whole nother issue for isolated people once you get on the internet, is the vulnerability to fraud and scams. So that's when the Attorney General's office and the U.S. Attorney's office and Adult Protective Service joined our work, and they're still in it every week, which is really incredible. So that as we're dealing with people who are lonely or alone or isolated, people who are learning the ropes on the internet for the first time, that we're educating people and building in protections for folks so that they can navigate all of that safely, and also understand that lots of us are being scammed right now, so we shouldn't feel embarrassed about it. That's just kind of the nature of the beast. So that's been a huge area of focus. And of course, then now it's so exciting. There's the light at the end of the tunnel, that we have vaccines that we're all getting. Trying again to find people who need the vaccine, folks who don't have the internet, how do they sign up for the vaccine? How do we get good information to people so they understand the vaccine is safe? We're doing a lot of work with the state and municipalities to help them understand how to prioritize older adults and why that's important, and just getting, good information out about that. So that's sort of been kind of the really interesting kind of progression of the Age-Friendly Rhode Island's Coalition's work over the last year. But I'll get back to programming, because when, we were talking about getting people up on the internet, and, how are people going to spend their days too? It's going back to remembering, March 13th of 2020, and we just began like the month of canceling everything, just canceling, and everything stopped. And we would hear from older adults, and we hear from all of our partners who serve older adults, that, people's days were completely unmoored. People didn't have schedules anymore. They didn't, couldn't get out of their house to do what they normally did. And then when we were asking people kind of what they missed most while they were in lockdown, people would say, getting together with my grandchildren, going out to, lunch with my friends, volunteering at something or other, going to the movies, what have you. But they would preface the thing that they missed always with saying, I miss looking forward to ... So there's not even this sense of like getting to plan something good for a month from now and getting to have that anticipation. Like that was just gone. So we talked a lot with our partners, and we looked at our website, which I said was not really very much of a public facing website before. It was really to be a resource for partners to help them do their work better and be more mindful of how to serve older adults. And we had this community calendar that was there, and we were paying for it, but it was not being used for anything. So we thought, well, could that be a virtual community center? Could that stand in for, all the cool stuff that would happen at senior centers and libraries, in person? Yeah. And we were also being contacted by a lot of entities who normally would do presentations at senior centers and libraries and other, community events, who had no place to put their information. So we were hearing from the financial institutions who would normally be giving presentations about, Medicare 101, or, planning for retirement, how to do a budget, all those sorts of things. They had no place to do their programming. The same thing, as I mentioned, the AG's office and the U.S. Attorney would normally do a lot of presentations about how to keep yourself safe from fraud and abuse. They had no place to take that. And we had all these artists and fitness instructors and all these people who had no place to put their programming and wanted to connect with older adults. So we decided to build a virtual community center, and I'll show it to you in just a second, which is was a very, very cool thing.
All right.
Yeah, so there we are, and there are older adults who are in their little Zoom screens there, and I would say first, if you want to just go up to there and put the monthly calendar on, which is initially our very beginning view. So you see, this is very busy, and we think it sort of discouraged people, but initially what we wanted to do was have a full day, every day, of choices of things you could do, some of which we produce that are live, like on Wednesdays at 1:30 we have Dance for All People with Rachel Balaban. That's one of our original programs. Some that we link to, like on Thursdays at noon, the Sage Rhode Island Zoom Cafe, so that's live, but we don't do it. And then and also the daily Blue Cross Blue Shield virtual fitness class you can link to. But then we have things that that other people are doing. Like you've done some really interesting things at the Westerly Library that we've just put up here. And some stuff is just recorded. We find some really interesting things. We have some interns that find really cool, like virtual garden tours and things like that we put up. But we've had the URI Master Gardeners and on, and we've had The RISD Museum gives some really interesting lectures, and we've had a virtual tour of the State House. So we have all this stuff here, and we wanted people to be able to look at the whole month and go, well, I don't have to worry about what I'm doing three weeks from now because I've got a lot, sort of planned there. But it's quite overwhelming, and we've changed the view now. So if you go back up to the just the homepage, and yeah, just today at the VCC.
Okay. So
And here's where you can see
highlight.
just what's happening today.
Great.
And you can
There's still, I mean, plenty of activities there.
yeah, there's tons and all different kinds of things. We have a
Mhm.
suggestion box where you can email us on our website. So if there's something that you wish you could do and you don't see it, then we have a lot of partners and we have some grant support to do, whatever kind of programming people want. We're finding too that if people are sort of reluctant to do something that, they sign into by themselves, that's sort of a statewide thing, and they want to get a group together, or if you wanted to get a group together at the library and that wanted a particular kind of programming, or maybe you needed some support for that with a little bit of funding, we could help with all of that. So yeah, so we're really excited to be able to do this, and as I said, Blue Cross has stepped up with funding for, they support our Dance for All People weekly class, and they put on some of their own programming. Verizon has given us some generous grants to add some more programming, which we'll be doing. Some of our programming is in Spanish, not all of it, but some of it is. And we just keep on trying to connect with community partners to make this available. Senior centers can take any of these programs that they want and put it on their own websites. They don't have to give us credit for it at all. We just want to make sure that people have access to things to do, ways to move their bodies around, ways to nurture their spirits, and things to think about.
Yeah.
And the demand, I think, for online programming is starting to subside as the weather gets nice again, and we all get our shots. But there are always going to be people who will benefit from this, and that's, I think, what we really learned from the pandemic. Social isolation has always been a problem, but when suddenly we were all so socially isolated, we all got it.
Yeah.
And if you think about if you have a cold and you don't want to give it to someone else, but there's this interesting talk you wanted to attend, you could do that online now. Or if you're recuperating from a knee replacement or an injury and you can't get out, you don't have to be as cut off as you once were because you could still participate in all this programming. And this is the way too to bring some really interesting programming into assisted living facilities or nursing homes in a way that doesn't bust the activities budget for those facilities because it's being produced for them. You can just get some folks into an activities room or a living room, socially distanced now, and put some of these things on a big screen, and people can enjoy them and participate. So yeah, so we're really happy to develop this, and this never would have happened if we weren't sort of forced to be creative to respond to the pandemic.
Yeah, so if anything positive did come from it, I think it did make us all think a little bit more about accessibility as a whole, for sure.
Yeah, yeah.
And
So
it's an amazing resource, and I think it's great that you are really open to sharing it with not only individuals, but like having people share it within their organizations too, really making it free to all, which is fantastic.
yeah, and this is our mission. We are so generously funded by the Tufts Health Plan Foundation to provide resources, and so that's what we're all about. And I will say too, a fundamental principle for us is that every single offering on here is free. So we do not put things on for which you would need to buy a ticket, or that we even if there's a suggested donation, we're reluctant to do that unless it's like just a really exciting offering and people really can feel comfortable not paying, because already by virtue of it being online, it's already by definition not accessible to everybody. We wanted to make sure that it was completely accessible to people of all incomes, and also just, you know, people are just so stressed out anyway that just should be
Yeah,
a good free community resource to use.
great.
Yeah. So thank you for putting that up.
Of course.
So I think the other thing I can bring up, so the other resource that I wanted to talk about that we've developed in response to the social isolation caused by the pandemic, and again, it's serving people directly, which we aren't going to do, is our Be Kind RI initiative to address the whole problem of lack of food access that I think 1 in 4 Rhode Islanders is experiencing right now. And, as I said at the beginning of our conversation, getting food to people when we shut down so, quickly was the first thing that was on everybody's mind.
Mm-hmm.
And lots of different efforts, really great efforts have been developed over the past year to ensure that food gets to people. So, senior centers that were normally having folks come to dine together, they're boxing up those meals and, having people pick them up, or, they know who's shut in and would get them out to folks. And there were special delivery services for folks who test positive for COVID that they would have access to. I think Rock's Fresh Foods was doing that for free for folks. And lots of us have learned how to use Peapod and Amazon Prime and Whole Foods and local groceries delivering. So those are all there. But it's still, that didn't cover everybody. And it certainly didn't cover the network of food pantries that we have in the state for people who really are in crisis and don't, can't pay for food, never mind a delivery service. So, some pantries were just doing some delivery. Family Service was doing delivery of their Be Safe boxes, but that was also putting a strain on them, and volunteer recruitment and, most people were putting their volunteer programs kind of on pause. So sort of left us there. So I will share my screen now and take you to the Be Kind RI website, which is our initiative. And so we have partnered with Family Service of Rhode Island and the Rhode Island Community Food Bank and a really cool company called Nesterly to offer this to Rhode Islanders free of charge. And I'll share, Nesterly is based in Boston, and they started as an intergenerational home share matching kind of program, so that looking at the spare bedroom in people's houses as an untapped resource for the affordable housing crisis, and making it possible for younger people who maybe they might be students, they might be young people just starting out in the working world who are really struggling to find a place to live near work that they can afford, and then older people who are living on their own and maybe struggling to pay their property taxes, and also lonely, and kind of matching people so that the spare bedroom is let out for less than market rate for a room. The older adult gets a little extra income, some companionship, and you can actually then, the guest can reduce their rent by offering to provide tech services or chore services or things like that. So it was a very cool thing that Australia had developed. But when the pandemic happened and the Age Strong Boston Commission was slammed with emergency requests for food and wellness checks, and they couldn't manage the volunteers, Nesterly pivoted and made this platform that now is kind of like a Match.com for volunteers and people who need help. So we've piloted here in a very Rhode Island way, Be Kind RI, just right now to help people who need grocery shopping done for them or a pantry pickup. So I'm going to show you, first of all, I hope some folks who watch this are interested in volunteering. We'll go to the volunteer sign up. which is really super easy. One of the coolest things about this website is if you go up here, you can pick any language pretty much that you speak, and it will translate the whole website. So this is really great. So I'll put it back to, oh gosh, I have to go back now to the bottom. Will I ever find English again?
If you just type in, if you start typing.
Thank you. I don't know.
I did see it there, so you don't have to go, I think, all the way to the bottom. Just go down the middle there. There you go. Right, up.
Yay, thank you.
Of course. We got there.
Yeah.
It really is. There's so many languages in there.
Yeah, it's just a very, very cool program. Family Service had access to it on their website already, so we just were able to put it into use.
Great.
And type in your name and your phone number. So if you're a volunteer, the volunteers do have to have a smartphone. People who are requesting do not, but volunteers do need to have a smartphone because you're going to get the request via text. Your email, your age, just because we're interested to know who ends up volunteering, who's doing it. Where you live and your zip code, which is important because then you're going to say what is the range that you're willing to deliver in. So it could be just, within your walkable area, or you can go, statewide. If you like to drive and put the radio on and you don't mind, maybe there's tons of requests in Providence, and you're down in Westerly and not so many. Maybe you want to spend a day in Providence delivering food to people. You can do that. Then check which languages you speak, and then how you can help. So right now, as I said, we're only doing grocery store delivery and food pantry delivery. But after a year, when we assess this, if it's working well, we'd like to add other services. Snow shoveling is always a problem. Pharmacy delivery, library book delivery, I said to you in an earlier meeting today, just for you. Help for new parents, signing people up for Project Hello, and even, if nonprofits need, 40 volunteers on a particular day to come and fill up food boxes for delivery, they'd be able to call for volunteers too. So I want people to pick all the stuff that they would want to do in the future. Make sure that you are COVID safe. And we're interested to know how people have heard of us, because that helps us target our outreach. So that is really easy. Now, if you want to request a volunteer, same thing. You put in all this information. Now, what's interesting here, or important here, is you don't need to fill out the form online if you don't want to. There's a phone number down here where you can call it in, or you can have somebody do it for you. So, if you've turned to an agency for help, so if you have, a nurse care manager, if you have a case manager, if you're at the senior center working with Nicole, if you've called United Way 211 or the Point at 462-4444, all of those entities can go online and fill this out for you. And if you don't have an email address, that's okay. They can put in theirs and can help you keep track of the request. And again, this information, a lot of it we have to keep track of because of the requirements of food pantries. So again, you put in all this information and you throw it out there. And then it's really cool because the request then it gets looked at by a social worker who makes sure that it's complete, and then out it goes into a text. So I've signed up for it, like, oh, my phone pings, like, oh, Cassie needs help with grocery shopping, and either I'm free, and again, you're given between about 24 and 48 hours to complete the request. So it's not like you just ordered pizza and it's got to come now, right? Yeah. So I'm like, oh yeah, I can do that in the next day or so. I'm going to the grocery store anyway, so this is good. So I hit accept, and then miraculously, a background check happens on me. And it's a national background check. It's to clear me, to make sure that I'm, I'm a safe person to be interacting with you. And if I'm cleared, then I get a request from you. I get your information from here, and I can call you up. And like in the comments, you might have put your list in here. You might just want to give it to me over the phone, and I figure out, am I going to come by your house and get a contactless, check from you, or am I going to get reimbursed from you when I show up with your groceries? And we just kind of take the whole relationship offline and we figure it out. So, and if I'm busy, I just ignore the request, and within 2 minutes it goes out to another person and to another and to another until someone finally just picks it up. And the other thing that's really great about volunteering is like, say, okay, I said I was going to do this. I've organized the whole thing with you. I get a call from my kid's school. He's sick. I have to go pick him up. I have to take him to for a COVID test. I can't do it anymore. I hit cancel, and the requests automatically start going back out to other potential volunteers. So you'll still get the thing you need within that time frame, even if I suddenly have to back out. So it's just a super easy, kind of no strings attached way for people to take some spare time here and there and help a neighbor in need, and a way for people to get free, friendly deliveries that might not have any other way to get food.
Yeah.
And the beautiful thing is, next time you need help, you could do it through this again. Or it might have been a really good interaction with the volunteer that you had the last time. And when you need your groceries again next week because you're still recuperating from that surgery, you can just take the whole relationship offline. So it's a way to find out that, wow, Cassie, I didn't know that you lived 2 blocks from me, and I didn't know that you needed help. Now I know you, and you're in my neighborhood, and I can help you more. So, so we're very excited about this, and hope that folks will sign up to volunteer and check it out. And will there's an email down here. Will let us know how it works, because it's a pilot, and I'm sure that there are things that we haven't figured out. And if people have ideas for improving it or little hiccups, they can let us know. And also, you should always call that number if there's any kind of issue with the delivery, like you can't find the house, or the person's not there, or they forgot, or they're there to help manage the interactions and make them go smoothly.
Great. And you said that this is live now, and you do have a good group of volunteers already. Of course, you're looking for more always, right?
We are looking for more. We have 200 now, which is what Nesterly told us we would need in order to really be able to handle all the requests as they started to come in. But we'd like to have ideally 1,000. That's what we're sort of kind of our capacity is, so that we're able to just help anybody who needs help. And there's a very, very good, I'm sure that people listening will have tons of questions here. We've really detailed frequently asked questions that answer everything, like what happens after I put in a request, how long do deliveries take, who's eligible, and I will say that's everybody. There's no income limit for this, or proving that you are a certain age or anything. We trust people, and we just want to make it easy, because many ways to request help, you have to jump through so many hoops. How can you pay? And then volunteering. Who can volunteer? You do have to be over 18. The background check, what if you can't complete? Delivery protocol, that's really important because it's contactless. And just, general questions. And if there's a question that is not answered here, send us a message. I'll stop my share here, but then I have one other thing that I would love to share with you, if I can just find it. Here we go.
Great.
All right. Here we go.
Hi, Mrs. Green. I just got the notification that you needed some groceries, and I'm on my way to the store now. So I can pick up your items as well if you let me know what you'd like. I'll be passing by your house around 4 if that's a good time to drop them off. I go around this time every week, so if you need another delivery next week, I'd be happy to help. I'll see you soon.
Thank you.
Very nice. Well, we're looking forward to hearing how this progresses, what kind of feedback you're getting and everything. And like you had said, if anybody does have questions, I mean, they can use the information on that website to contact. If you needed help signing up, come to the library, talk to us. We can try to help you. The senior center is there. I mean, there are resources that can help you get started with it too.
Yeah, thank you for being such an amazing partner in getting these resources out to the community.
Thank you. We really appreciate it. Is there anything else that you wanted to go over? I mean, that's
Those are the main
lots of
things.
information.
Yeah, we have our fingers in a lot of different pies. I will say, you know, this is going live before next Tuesday, April 6th. We are co-sponsoring a really great forum online with AARP Rhode Island that folks in Westerly might really find interesting. It's Tuesday the 6th from 10 o'clock to 11:30 in the morning, and you can go to the you can go to agefriendlyri.org or the AARP RI website to register. But it's a forum on livable communities, and we have a really exciting keynote speaker who is the AARP State Director in Maine, Lori Parham, where they have, I think, over 70 livable communities, and they are an age-friendly state. And she's going to talk about how they made that happen and what sort of exciting, you know, partnerships happen at the local level. And then we're going to have a panel of 4 people representing 4 communities throughout the state in Rhode Island who have taken or are taking steps to become age-friendly communities, whether the formal AARP designation or kind of on their own terms. And our own Laurel Holmes from Westerly Hospital, who runs the Age-Friendly Westerly Committee, is going to be one of the panelists and talking about all of the amazing things that all of you are doing in Westerly. So I think people will really want to hear that.
Great.
Yeah, and you'll also be hearing what's happening in Newport, and Cranston is becoming a dementia-friendly community. And then in Central Providence, where they have the Central Providence Healthy Aging Network, where it's largely immigrants and kind of the challenges and interesting ways they're tailoring this work there. So people see that becoming an age-friendly community is not a cookie-cutter, one-size-all thing. It comes up from what people in every neighborhood and every city and town, every community wants and needs, that they decide, that you decide. So I invite everyone to join that.
It's going to be a great program. And what we'll do is we'll include the link to that in the summary for this video. So if you go down, you should see it.
Great, thank you.
Great. So thank you so much for coming today, Catherine, and for sharing all that with us.
My pleasure. Thank you for the invitation. And as I said, next time I hope it's live in your gorgeous, gorgeous building, or maybe
I think we're getting
outside in the beautiful park.
I know. It's a beautiful day. Yeah. All right. Well, thank you again. I appreciate it.
Anytime. Thank you, Cassie.